Welcome to your annual in-services and review. Your instructions from this point forward are to watch the YouTube video, take down the information, and follow the link to the quiz so we can do this all online. Hopefully this won't take too long. We're going to start off with bloodborne and airborne pathogens. This is an OSHA requirement that you are mandated to have every year. Your infection control officer is Alan Martino. Your risk manager is Luke DeRosa. What are some common bloodborne pathogens? As you can see here: malaria, brucellosis, syphilis, hepatitis B and C, and the HIV virus. Here are some of the symptoms of hepatitis B: jaundice, fatigue, abdominal pain, loss of appetite, nausea, and vomiting. There has been a vaccination for hepatitis B available since 1982. If you have not received this vaccine yet, please see myself or Luke to obtain this. The other is hepatitis C. There is no vaccine for this. It is the most common chronic bloodborne infection in the United States. It has the exact same symptoms as hepatitis B. The only way to tell the difference between the two is with a lab test. Your exposure potential in the treatment, either ALS or BLS of patients, cleaning up of the ambulance, post-accident cleanup, handling of returned medical waste, general maintenance and janitorial duties, handling of any waste products, and of course sharps. What fluids are potentially carrying any of these viruses that you don't want? OPIM is other potentially infectious material. Cerebrospinal fluid, synovial fluid, amniotic fluid, peritoneal fluid, pleural fluid, or any fluid that contains visible blood. No risk if there is no sign of blood, as these over here to the right. How do we protect ourselves? Use of proper proper protective equipment. That being blood, bodily fluids. Protect yourselves with gloves, gown, masks, all of which are provided to you. We provide latex and nitrile gloves, goggles, barriers, aprons, respirators, anything that you would need should be available in the ambulance. If it is not there, then you need to make sure that it is and see one of your supervisors to obtain said materials. What is regulated medical waste? Anything that's contaminated or saturated with blood. A small smear is not necessarily what they consider regulated medical waste. Anything that's considered medical waste is saturated with blood and sharps. There are red bags in all ambulances. These must be disposed of at a hospital. We do not have the ability to dispose of regulated medical waste at any of our facilities. Sharps containers can be disposed of at either Jameson or Elwood City Hospital, never left in the truck or at an NAS station. All of our stations have utility sinks. These are our designated biohazard decon areas, and they are all clearly marked. There should be no food, drink, or applying of makeup, contacts, etc. Sharps containers, contaminated needles, lab draw syringes, IO needles, anything that's going to be sharp that has been in contact with the blood. Make sure you look before you touch. Do not solely trust your safety devices. These things can fail. Treat every sharp as if it was contaminated. Never recap your needles. If you do have an incident where you are splashed, stuck with a needle, or other type of blood or other potentially infectious materials, report that immediately to your supervisor after washing the area off with soap and water and or flushing your eyes. We will offer post-exposure medical evaluations if needed, and they will do patient follow-ups as well. The hepatitis B vaccine is strongly recommended and is provided to you at no cost. Airborne pathogens. Protection against airborne pathogens. We do have a written plan for that. It is separate from the bloodborne pathogens. What is an airborne pathogen? Well, it's a bacteria or a virus that's carried in droplet form. These are dispersed from a cough, sneeze, or speech and carried through the air and through ventilation systems. Here are some examples of airborne diseases: chickenpox, anthrax, smallpox, influenza, and tuberculosis. A person may contract pulmonary tuberculosis from inhaling droplets from a cough or a sneeze. It is dependent upon the length and concentration of exposure. Dilution is the solution to pollution. So the more air you have moving, the more the droplet forms are spread out, the less chance you have of obtaining any of these viruses via the air. High prevalent cases of tuberculosis are here on the slide. Trying to identify an airborne disease. If you have a cough greater than 2 weeks, fever, fatigue, loss of appetite, night sweats are all signs of tuberculosis. We do a TB risk assessment. In EMS in general is considered a low risk. There's only 3 cases reported in Lawrence County in 2007. No cases involving Noga ambulance service at that time. The biggest thing to know about airborne is to protect yourself. Know the signs and symptoms. Mask your patients. A simple surgical mask will do. Open the windows. Engage your ventilation system. There is an annual screening questionnaire as part of your quiz. And ask questions. Poorly ventilated spaces, we need to ventilate. So open up windows, open up doors, engage your ventilation system like I said. If you have a question or a problem or you want to make change, then you need to bring it to the safety committee or to Luke or to myself. The airborne and bloodborne pathogens are reviewed annually and updated as needed. This can be found in your infection control manual, which are located on EMS charts and at all the stations in the big orange binder. HIPPA. Biggest thing we need to know about HIPPA is what happens here, what you say here, what you see here stays here. This is to protect the privacy of your patients and safeguarding that information to the best of our abilities. Sources of protected health information are anything that has the patient's name or medical records to it. Patient care reports, dispatch information, billing, incident reports, any verbal communications between healthcare providers, any patient records that you obtain, and PMNC statements. You want to respect the privacy of your patient information as you would your own. Do not share this with others not involved in the patient's care, except when permitted or required. The main goals of protected health information is to keep disclosures at minimum amount necessary to get the job done. You would certainly not want people knowing all of your information just because somebody was careless with your paperwork. Here's the golden rules. What you see here, what you hear here, what you say here, what you do here, stays here. We certainly don't post any protected health information, locations, accident scenes to Facebook. You would certainly not want that being the way you found out one of your loved ones was ill, injured, or dead. Our 3 basic uses of protected health information are treatment, payment, and healthcare operations. Treatment: you may freely give PHI with other healthcare providers who also treat the patient, back and forth with facilities. Again, the minimum amount necessary rule does not apply for treatment-related disclosures. We use PHI to file claims with payers and send bills to patients, and we capture signatures on every single patient. Brenda Reynolds is your privacy officer. Any questions regarding PHI or HIPAA privacy practices need to go through her. As far as healthcare operations go, this is going to include quality assurance, continuous quality improvement, training, and certain management functions, and this is where the minimum necessary rule applies. Can you send PHI over the dispatch? Yes, you can. Any other agencies? Yes. It is still PHI, so we do not post call locations or tweet locations of our scenes. You want to take care to minimize incidental disclosures. This could be speaking with a police officer or other healthcare people when the general public is around. What?
Or providers not involved in the direct care of the patients. We want them.
Or provider, right, what Luke said, or providers not involved in the direct care of patients. At the hospital, you may give your PCR to the hospital. Again, the minimum necessary rule does not apply. You may give verbal report. You want to assure that others not involved in the patient's care, bystanders and other family members are out of your earshot. You may obtain your face sheet or billing information from the facility, and remember, you must leave a quick run report with the patient and the patient's chart. This is a state requirement. How about after the call? Well, we always talk about certain calls, interesting calls at the station. That is all allowed as long as PHI is kept within the doors. There is a right to know and a need to know. This is your minimum necessary rule. You want to talk about a case, that's fine. Leave the name out. How do we safeguard PHI, written PHI? We have drop boxes at all the stations, as you are aware, and this information is brought to billing. This is so it is not accessible to the general population. Safeguarding electronic PHI. You want to focus when faxing, make sure you're getting the right number. Also use a disclosure statement with your fax. Use your Noga email for sending PHI and have a disclosure statement on that. And making sure that you log off your computer. I know some of you have had some interesting screensavers lately because you were careless with your computer. So please make sure that you are logging off of your computer so nobody else can access PHI, because it will be blamed on you. Verbal PHI, using appropriate voice volume and no inappropriate banter about specific patients. How about mass casualty incidents? We are allowed under certain auspices, for example the American Red Cross, if a mass casualty incident, to tell them what patients went where. This is for the purposes of family members finding their loved ones.
We're going to pause now, take a quick break. There'll be a second video that you can catch the next presentation, which is going to be the emergency action plan.
Okay, your emergency action plan. If there is a fire, activate your building alarms, call 911, evacuate the building, closing doors behind you on your way out, notify dispatch of what is going on if you are not already there. Under no circumstances should you attempt to fight the fire that is past the incipient stage, and in the words of Luke, RLH, which means run like hell. Get out of the building. We can replace the building. We cannot replace you. All fires or emergency situations should be reported as soon as possible to the highest ranking company officer. And you shall meet at your designated assembly areas. These are the areas for Station 20, Station 10, Station 30, and Station 40. All of our fire extinguishers that we have here at Noga Ambulance are Class C extinguishers, or ABC, dry chemical extinguishers. Class A fires, this is your water extinguishers. Class B fires is your flammable gas. Class C fires is your live electrical equipment. These are carbon dioxide extinguishers. All of our extinguishers are ABC rated, dry chemical. This is how you use your extinguisher. It's called pass. Pull the pin. Aim at the base. Squeeze the handle. Sweep side to side. If you cannot extinguish the fire in the incipient stage with one fire extinguisher, it is time to get out. Medical emergencies. In the event of a medical emergency at a station, should be reported to dispatch as soon as possible, and do what you do best. Treat the patients. Police or security emergencies, anything that involves the police, somebody coming into the station, theft, whatnot. Number one, notify your on-duty supervisor, and number two, notify the police as soon as possible. Severe weather. If you notice severe weather coming your direction, whether it be tornado, hailstorms, whatever, you need to take cover located deep within the building. Inside Station 10, for example, would be the bathrooms. Inside Station 20 would be the basement downstairs.
Unless it's Godzilla, then you have no help.
Right. And you will be directed from there as to what your duties will be after. Hopefully it's not going to be search and rescue. So basically what we're telling you is we're going to shelter in place. Your hazard communications, it is our responsibility to have this written program for you. And it's basically involving our chemicals that we have here at the station. Fortunately, we do not have a lot of bulk chemicals. We do transfer some chemicals to smaller spray containers as seen here. And all of them should be labeled. If there is no label, you need to notify the on-duty supervisor so that we can place a label on them so we know what is in there. And we add the chemical name, the common name, the manufacturer's name, the hazard rating on the MSDS or material safety data sheet, and contact the supervisor or Luke to have a label put on. All of these are at the stations. This is your right to know information. These are updated as needed. Material safety data sheets. All the chemicals that we have here at the stations have a material safety data sheet in them. There is no prescribed format, but the content for all the MSDs is the same. It will tell you fire, health, infection, and treatment of any of the materials that we have. We also have eye wash stations at every single station. If you get something in your eye, whether it be a chemical, gasoline, whatever, you need to turn the water on, pull the handle, put your face in the water, make sure that your eyes are flushed for 10 to 15 minutes, and then contact your on-duty supervisor to report the injury, and we will have things taken care of for you for there. Compressed gas cylinders must be kept in their designated areas. They must not be left out in the floor area, unsecured in an ambulance, and no clutter around them. When moving them, use the cart. Make sure that they are secured to the cart. Don't drag them, don't pull them, and make sure that you have enough help to get these heavy cylinders moved in and out of the ambulances. General housekeeping, we have our yellow flammable cabinets. In here you will find your oil, diesel conditioners, any type of flammable liquids. Everything is kept in these cabinets. There's one at each station. No heater, smoking, flames, clutter. You take care of all that, then we don't have a problem. This concludes the 2014 annual in-services. Now please go take your test.
Thanks. I should stop, eh?